Hi, I'm Lori Hutchison. I'm Executive Director of the Lobular Breast Cancer Alliance, and I'm very happy to welcome everyone today to this conversation about our newest local advocacy team. And I'm going to turn it over to our local advocacy team volunteer coordinator, Kathleen Moss, who will be speaking with our team members and will introduce you to them and all that they're doing. Kathleen?
Thanks, Lori. So we're in about 6 months past the start of the cohort of local advocacy teams. And we have planted two teams now. The first was in South Carolina, and this new team is in the Washington, D.C. area. And we have our two members of that LAT local advocacy team with us today. It's been really fun to get to know all of the different folks from around the country. For me, we have no idea who's going to emerge where and where the leadership is going to come from and which groups are going to be willing to launch as an official LAT. But Brenda and Jeanette launched pretty quickly after they arrived in our cohort in the last couple of months. And I'm excited to ask them some questions about the formation of their local advocacy team today. So Brenda and Jeanette, I'll be asking you a few questions about what this project has been like for you. And I'd like to start with Brenda. Can you tell us about how you found the LBCA and our local advocacy team cohort?
Yes, hi everyone. When I was diagnosed with invasive lobular cancer in September 23, just several months ago, I had never heard of lobular. And after my radiologist told me they had found this, I was searching everywhere and really couldn't find that much information and was very happy to find the Alliance because there were fact sheets, contacts to talk to folks, and that meant a lot to me. So that was how I found the group. And when I discovered through reading that there's not specific research generally, on lobular breast cancer, I really wanted to get involved in advocacy to help on the research end if possible, and in education.
And Jeanette, how did you find us and what brought you to this work?
Sure. I, just like Brenda, uh, not when I had my official diagnosis, but as I was waiting for that diagnosis, we had an idea of what it might be. And so when I started doing some research, LBCA showed up in my search, and it was nice to find a group that was dedicated to what I assumed I would be facing, which I was going to be facing, the diagnosis and the focus on research and the information that I could then take when I finally had my meetings with my oncologist and my radiologist and my physicians, and really it helped educate me in going into the door to ask some very hard questions, and then be able to then go back to the website and kind of compare my notes and delve a little bit deeper along the way. And so with the addition of the advocacy piece now, it really lends itself to give me a voice into my community about why this is so important to know about.
Thanks, Jeanette. Maybe you could say just where you live. I know the DC area and Maryland and Virginia, that's a pretty big area. So would you tell us where you live in that area?
Sure. I'm right outside the Annapolis area near the BWI airport.
And how about you, Brenda?
I'm in Bethesda, Maryland, right on the border of Washington, D.C.
Thanks. So going back to you, Jeanette, now that you've just formed your new local advocacy team, can you tell us what some of your and Brenda's goals have been? What have you developed on your goal list?
Sure. So Brenda and I met immediately when we joined this group and realized that we had a lot in common, but we also had definitely a desire to reach different types of audiences. And so we knew for sure we wanted to get some information into our own personal doctor's offices to ensure that they were educated and their staff was educated and they had a resource to hand to the next patient who came through the door who had lobular. And then on top of that, thinking through that that's almost the end point sometimes when people have maybe done some of their research already, and backtracking it into thinking, how best can we educate those who aren't even affected by breast cancer yet? So they understood the uniqueness of lobular. So when they went to have their mammogram and they were told they had dense breasts, they could ask the follow-up question and be, just self-advocate for themselves. And so from my side, I'll share, I'm reaching out to some mom groups. I was 42 when I was diagnosed just 2 years ago. And so knowing that you can get your mammogram at 40 now, we always think it's not going to happen to us at this age, but it does. And so really getting into, writing some blogs, maybe an op-ed in preparation for October, and October 15th specifically for LBCA Awareness Day. That's part of our planning so far from my perspective.
Fun. And Brenda, on your side, you have some different activities planned?
Jeanette and I have been working hand in hand, and we're just getting this group going. But our main goals are really, as she mentioned, education, our providers, other folks and women's groups where we can, and writing articles, op-eds. In my case, I'm interested in all ages, but I know that the average age for lobular cancer diagnosis is 62. I'm younger than that, but I also think it's important for older women to know about this disease, and that's even a possibility. Since I've gotten it, I have been talking about it to all my friends, and several have come back to me and said, when I now go for my mammogram, I ask about lobular too.
Very cool. So our LAT, or Local Advocacy Team meetings, have a monthly hour-long cohort meeting, and it's just kind of everyone's invited, whether you have a LAT or not, and whether you're doing local advocacy work on your own or with others at this point. And that's been a really fun process for me to lead. And I wanted to hear from you, Brenda. How is it for you to come to those meetings, and what have you learned, and what have you gained from the meetings themselves?
It's been very helpful for me, and I can think of at least two reasons. One, it was the first time that I got exposure to a group of women of all ages who had lobular cancer. Before that, I had not met anyone, and that is really powerful. Second is, as we're getting started with our LAT, and we're trying to figure out, every LAT is going to be different, and based on the region you live in and the resources and access you have, you'll be doing different activities. And I have really enjoyed hearing from other members and other LATs from around the country to get their ideas and think, oh, that might work for us. So I really like the information sharing every month, and look forward to getting new ideas that maybe we haven't thought of yet.
Sounds good. Jeanette, do you have anything to add?
Just in addition to hearing what others are doing, also hearing what others are facing as barriers of entry when they want to get the information out, things that we may not have been faced with yet, that then we can brainstorm on ways to overcome it, has been very helpful.
Definitely. So Jeanette, what do you see as the advantage, or maybe kind of why did you decide to become an official LAT with LBCA and become an ambassador of ours, rather than just staying an informal ambassador or advocate, working with education around lobular breast cancer in your community?
It added legitimacy to me when I walk through the door or make a phone call. It's not just me as a patient saying, I have some information I'd like to share. I actually can say, I have a brochure from LBCA that has been vetted, and they are an official group, and I represent them. I am here on behalf of them for our local community, which definitely adds to the value of the resource. They're more willing to put it out in their waiting rooms or hand to their patients or to their colleagues in an office. So I didn't want to go alone with this. I wanted to make sure I had the backing and the support when I have questions around this, that I can connect with those that are doing it in different parts of countries, but also the staff at LBCA and the board who are the experts in this area.
Thank you for that. And can you talk a little bit about what you've learned since jumping in and starting local advocacy work so far?
Sure. That don't be afraid to just ask. Reach out to the groups that might feel far-fetched. You might just have an info email address. It doesn't hurt to ask to have a meeting, or if you had an idea to share. And that's how I was able to connect with a nationwide publisher of a mom newsletter. And we might actually have something that goes nationwide through it. And so just because I wasn't afraid to ask. So it's a great way to help your local community and then the women's groups that are out there. And then just helps me think through, just other ways that we can get the information out and then how we can build from that.
It's been so enjoyable for me to see the diversity of ideas that come out of our group, and that's no exception. Just your connection to that kids publication, mom's publication. It's so fun to see that develop and hear that story from you. How about you, Brenda? What have you learned since jumping in? I know you've just started, but anything you want to share?
Yeah, just how powerful the voices are of the members. I think I have mentioned to you, I've been an advocate for a number of causes for most of my career, but in becoming part of the LAT and working on this issues, it's obviously very urgent and immediate because it affects me. But meeting all these wonderful women who are in various stages of the disease, it just really makes you want to go out there and educate and advocate, so people know about this disease and we get closer to finding a cure. So for me, what I've learned is just people are from all over, all ages, and this is something that we need to educate on.
Yes, definitely. And do either of you have any advice for others that are considering starting a formal local advocacy team with the LBCA?
Yeah, I would say don't be afraid. It's not as hard as you think. Our group is just evolving, so you don't have to have all of the answers. Jeanette and I meet periodically to discuss ideas, but it's always evolving, and you have great support from the Alliance team and from the other LATs.
And I
Thanks.
concur with Brenda. I think don't be afraid, and no matter what your background is, you might feel like, well, can I really make an impact? And the answer is yes. Small efforts and small movements is still movement. And then knowing that I'm making some movement, Brenda's making movement, the other LATs are making movement. There's just ripple effects that come from it, and it's definitely worth your time and effort.
Brenda, I wanted to ask you about some of the contrast between your former work as a public policy specialist in the aging services sector. And I know that's more of a professional role for you, and this is much more of a personal role. How is it different coming in as a patient and someone that's been personally affected by the kind of issues that you're working to raise awareness around?
Well, obviously, it's very personal. I didn't really know anything about breast cancer before I got the disease. It's been helpful that I do have an advocacy background because I think I felt ready to just jump right in there, and I have kind of an idea of how to reach out to folks and speak to folks. But I want to just add, for people who are thinking about getting an advocacy, it's not scary. I've talked to many people who think policy and advocacy is something they can't do. And I view it really as just being an educator and telling your story. In any advocacy, your story is the most important thing you can do. Stories change lives, they change policy, and it's just something I hope we can get more people involved in our LAT and throughout the country.
Thank you. I do too. there anything that either one of you would like to say that you really wanted to share today with others about the experience of forming a local advocacy team in your area that I haven't asked you about yet?
I would like to share that when I hear the term advocacy, you tend to think of the politicians and going on the Hill and big grandiose efforts, and it is that's a piece of it, but advocacy is education, and we all know that knowledge is power, and so the more knowledge and education that you can share beyond your four walls where you sit each day in your home can really make a difference. And so don't be nervous about the term advocacy. It really is being the individual who has a lot of information that others are looking for, and you can be the vehicle to deliver it.
And I just want to add, for me, when I got diagnosed and my whole world felt so out of control, and finding this group and the LAT and talking to folks made me feel in some way, I don't know what I'm doing in this whole world and I'm scared, but I can help to make a difference for other women. And that for me was very meaningful. And one of the reasons that I really enjoyed being a part of the Alliance.
Thank you both so much. It's true. Being an advocate just means being a learner. And when we're learning something for the first time, that is the best time to share the information that we're learning, because it's coming from that fresh perspective that others can relate to. And I'm just so excited to see what you do in the coming years together in your local area in this in-person way, on the ground, boots on the ground way. So thank you for being trailblazers in this work and setting the example and inspiring others who will come after you. We have so many that are eager to start this work, and I just thank you so much for jumping in and starting right away. We'll definitely be in touch and hear as a follow-up just how you're doing in coming months and years. So
Thank you.
thanks again.
Thank you for supporting us.
Thank you.